Hi, it's Janet, and I'm here today to talk to you about another topic related to HIV. And today I'm talking to you about HIV and triple diagnosis. Triple diagnosis is substance abuse, mental illness, and a client who is also HIV positive. Substance use disorders and psychiatric illness commonly occur in what is called out in the field a dual diagnosis. When the spread of HIV started to occur in individuals who had the dual diagnosis of a substance abuse problem and psychiatric illness, the triple diagnosis emerged. And this diagnosis has and continues to be a very clinically challenging condition for primary care physicians, addiction medicine specialists, and psychiatrists. Existing data out there right now supports the high prevalence of triple diagnosis patients in psychiatric, substance abuse, and HIV treatment facilities. A little bit about the prevalence of triple diagnosis in a sampling of a little over 1,000 individuals who are receiving HIV care. 60% of those individuals reported symptoms of mental illness as compared to the general population where the rate is 22%. 32% reported substance abuse problems, whereas the rate in the general population is about 9.5%. And 23% of them reported both substance abuse and substance abuse problems and symptoms of mental illness, whereas in the general population this rate runs at about 3%. When an individual has a triple diagnosis, it impairs the well-being and the quality of life of that individual significantly. They have higher levels of distress and physical impairment compared to those individuals who are diagnosed with HIV and don't have a psychiatric or a substance abuse problem. This interaction between mental health and substance abuse problems elevates both the level of risk and the severity of the HIV that the client has. Drug and alcohol disorders commonly go along with depression, anxiety, and severe mental illness. At the same time, depression in HIV individuals is underdiagnosed and undertreated. Now, when an individual is infected with HIV, there may be triggers that are going to cause them some sort of mental distress. And some of these triggers may be when the client learns of first of all, of their HIV positive status. And it may be someone who is a past substance abuser, and because their substance abuse was a way of coping with stress in their life, this trigger of the diagnosis may drop them back into their substance abuse or their addiction that they have been in recovery for. Another trigger may be at the time, or if they do disclose their HIV positive status to their family and friends. And disclosure is a very big issue for individuals who are infected with HIV. Another time that may be a trigger for some sort of a mental distress in an individual is when the doctor introduces medication. Sometimes people sort of stay in the state of possibly denial, and then once the doctor says, I'm going to put you on medication, the reality of the disease of HIV becomes much more real. Also, if they suffer from any physical illnesses, or have any new symptoms or the progression of the disease, if anything happens. This could be a trigger for them to relapse or to suffer some sort of mental distress. Another thing that may cause this to happen is hospitalization. If they are diagnosed with AIDS, because the infection has continued to progress. Possibly if they had a significant other or a death of that individual. Sometimes holidays are a trigger. If they have to make a change in their lifestyle based on their diagnosis of HIV. And if they're at a point when they need to make end-of-life and permanent planning decisions. These are also triggers for mental distress or the relapse for substance abuse. And not only being diagnosed with substance abuse and with mental illness increases an individual's risk for contracting HIV, but this is also associated that those people who are diagnosed with a triple diagnosis have a decreased likelihood of using HAART treatment, which is the highly active antiretroviral therapy, less likelihood of adherence to the treatment plan. And we've talked about that the importance of maintaining and staying on the medication and adhering to the plan is because we can develop resistance to the medication, and then that medication will no longer work for the individual. And also there's a decreased likelihood of virologic suppression, that they will take the medication, that they will adhere to the treatment, and therefore have a decrease in the amount of HIV virus in their body. Because a diagnosis of HIV affects every single aspect of a person's life, simple awareness of the disease as well as the progression of the symptoms can precipitate new or exacerbate existing problems that the individual has with mental health and with substance abuse. So getting the diagnosis, as I said. As a result of this, these problems or issues increase an individual's need for healthcare services in order to help them work through the multiple issues that they have. Not only does the HIV infection increase a person's risk for these different psychiatric disorders, and those are psychiatric disorders anywhere from depression, anxiety, mania, dementia, as I talked about in my previous talk about how HIV, the virus, can go to the brain and mimic symptoms of dementia, but it increases their risk for, as I said, many of these psychiatric disorders and substance abuse as well. For people who are adherent to their medication regimen, and they are triply diagnosed, the antiretroviral regimen itself, the medication that they may be on, could often either precipitate or worsen some psychiatric symptoms that they have had in the past, that they're having problems with now, and this would inhibit the positive health outcomes that we're looking for when we have an individual in treatment. Other issues that go along with HIV, substance abuse, and mental illness. If an individual is a substance abuser, there are If they continue to use, there are adverse health effects of the substance abuse, depending on what type of their drug of choice is, including infections, malnutrition, stigmatization, homelessness, also organic syndromes that are related to the direct effect of the drugs or the way that they utilize the drugs on their tissues. Another issue is that society tends to marginalize and criminalize substance abusers. As a result of that, they may not have the relationship with the healthcare provider. They sometimes, depending on where they go for care, may be treated in a different way. And studies have confirmed that HIV positive substance users actually have less access to care. They have less access to heart, the treatment. They have poor adherence to the therapy and poor health outcomes. Adherence to treatment, poor adherence is not uncommon because sometimes the medication schedules are complex, they're inconvenient, the drugs have side effects, and these can be a combination of putting the drugs together for the HIV, let's say, the HIV medication, and the drugs for their mental illness. In order for them to work properly, they have to be taken for a long period of time. So sometimes when someone is diagnosed with depression, they may need to be on the medication for 6 to 8 weeks, sometimes longer, to see if that medication is indeed going to work with them. Another issue, a factor that individuals who suffer from mental health problems and substance abuse problems cited that were interfered most with their adherence to the medication was the time and effort it takes for them to get their medication, as well as integrating their medication and everything into their lifestyle, including going to appointments and being where they need to be. So this suggests that it's really important to screen and provide treatment within the facility. Hopefully it's sort of a one-stop shop for individuals who are being treated for HIV, for mental health problems, and ways to help them cope with the complex medication schedules. There are barriers to treatment for these individuals with poor access to treatment, because if they're actively using the drug, they are not going to keep their appointments. They may, if they're not keeping their appointments, they're using at times when they're supposed to be there. They forget about their appointments. They may have unstable housing in order to keep their medication in one place. They may have a lack of food, a lack of transportation. However, that's why HIV and some of the Ryan White funding, and I talked about this before, provides transportation for people. Sometimes if an individual is a female, she may be a commercial sex worker where she's turning tricks to pay for her drugs, which in turn is putting her at greater risk for developing another strain of the HIV virus. She may not, or the individual may not be able to go into a drug treatment program. She may have children at home. Maybe they were recently incarcerated or incarcerated. They may not be able to find where there is a healthcare provider. So these are some of the reasons that prohibit these individuals from either getting into care or dropping out of care. And also the complexity of dealing with the system and how to navigate the system also affects an individual. Also, people with HIV who struggle with mental health and substance abuse issues may be more likely to engage in unsafe sex and needle sharing behaviors than other individuals, thus increasing the risk of spreading the disease or them getting reinfected with another strain of HIV from someone else. That can be if they're using drugs, if they're shooting dope, they're sharing body fluids, increasing their risk for that, as well as increasing their risk for hepatitis, which is going to further complicate the disease. Depending on the drugs, as I said, the injectable drug user, sharing the needle, sharing the water, sharing the works, anything like that. With club drugs, crack, marijuana, and alcohol, all these drugs, basically all the drugs, can affect the immune system, which is going to further compromise the immune system because people are out there using, they're going to get sicker quicker, they're not taking care of themselves, and so their immune system is already beat up. Then you give them HIV, and the risks that they put for violence and things increases the risk. Now, even though injectable drug use, we know, is the highest risk behavior in the transmission of HIV, some of these non-injectable drug users may engage in HIV risk behaviors for, even though the risk is not such a high risk, they engage in the risk many more times because a typical HIV or injectable drug user may inject drugs anywhere from maybe 2 to 5 times a day. You know, it varies, some more, some less. Whereas someone who's smoking crack is smoking it every 5 minutes, 24/7, 24 hours a day for a couple days. They need to get their drugs, so they're going to engage in activities to keep getting that drug that may put them at risk for getting reinfected. As new treatment regimens are coming out to increase the lifespan of people infected with HIV, there is also greater attention being paid to optimizing the mental health of individuals who are infected with HIV, having them have the more one-stop. You're going to come here, you're going to get your HIV care, you're also going to get your mental health, and we are also going to, do some substance abuse, possibly substance abuse treatment or counseling there as well. These individuals, given the multiplicity of the problems faced by people who are with HIV, who have mental illness, substance abuse, or other co-occurring disorders, hepatitis C, they are studying more and more about the role of specialized program in the treatment for these people. They oftentimes need more complex treatments because we're treating many different things, and they have an increased need for support services because of these multiple diagnoses. We know that the identification between the link of substance abuse and unsafe sex, we know that if we're using drugs, we're at less likelihood to protect ourselves. And there are programs aimed at reducing unsafe sex, and particularly programs that are out there in regards to unsafe sex amongst MSMs, men who have sex with men. Individuals who are triple diagnosed rarely receive adequate and flexibility is really, really important with these individuals. And integrative care, incorporating and coordinating treatment for all of the illnesses. Many of the programs are sort of this one-size-fits-all system of care, and this is inadequate to meet the complex needs of this population. Clinicians who treat this triple diagnosis should view it as comprised of 3 intertwined conditions, and each feeds off of the other one. It's important to treat the whole person and not just individual parts of this person. That's why if the person can have all their care under one roof, they're generally more successful. A holistic approach provided by an interdisciplinary team, a culturally sensitive clinical team, a team of case managers, of social workers, of medical providers, counselors and therapists, and psychiatrists who are going to share in this treatment plan. Targeted HIV prevention with these individuals should include both sexual and substance abuse risk reductions that helps these people. There is also a term that's referred to as triple stigmatization associated with having HIV, a psychiatric illness, and substance abuse. Kathy, I know, has talked to you about stigma in HIV, and it results in the extreme marginalization of this population and further reduces the individual's self-esteem, oftentimes precipitating self-destructive behaviors, which in turn delay or undermine the treatment that the individual is on. Sometimes there are perceptions by healthcare providers that substance abuse and mental health problems are indicators of character flaws, of moral weakness, as opposed to treatable medical conditions. So it's important that this person get into an appropriate treatment facility. Anyone who is triply diagnosed. So not only, as I said in my earlier talks, the importance of them getting in with a experienced ID physician who's experienced in treating HIV, also someone who is experienced in working with substance abusers and working with individuals who are mentally ill. All of these issues underscore the need for early diagnosis and treatment in HIV individuals in order to reduce mental illness, substance abuse, and to help slow the progression of HIV disease.